Malignant melanoma is the deadliest form of skin cancer, originating from melanocytes, the pigment-producing cells in the skin. Now, although it is less common than basal cell or squamous cell carcinoma, melanoma is far more aggressive and accounts for the majority of skin cancer-related deaths due to its high metastatic potential. It can occur at any age, but it is most commonly seen in adults. Key risk factors include a family history of melanoma, fair skin that burns easily, light hair and eye color, a history of blistering sunburns, chronic sun exposure, and the use of tanning beds. Individuals with a history of atypical or dysplastic nevi. What's a nevi? Silly goose, it's a wart. And those who are immunosuppressed are also at higher risk. Clinically, melanoma typically develops on sun-exposed areas, but it can also appear on mucous membranes, the retina, or even under the nails as subungual melanoma. Early detection is critical and is guided by the ABCDE criteria: asymmetry, border irregularity, color variation, diameter greater than 6 millimeters, and evolving changes in size, shape, color, or symptoms such as itching or bleeding. Subungual melanoma often appears as a dark pigmented streak under the nail, and the presence of pigment extending to the nail fold, which is called Hutchinson's sign, is a concerning feature. The diagnosis of melanoma requires biopsy, preferably an excisional biopsy if feasible, to allow for accurate measurement of tumor thickness. Shave biopsies should be avoided if melanoma is suspected because they may underestimate the death. The most important prognostic factor is the Breslow thickness, which measures how deep the tumor extends into the skin. Sentinel lymph node biopsy may be indicated to assess for regional spread in intermediate thickness melanomas. Treatment of melanoma depends on the stage of diagnosis. Wide local excision with appropriate margins is the cornerstone of therapy. For intermediate and high-risk cases, sentinel lymph node biopsy is performed to guide staging and further management. Patients with advanced or metastatic disease may require systemic treatment such as immunotherapy and checkpoint inhibitors, targeted therapies, or chemotherapy. Prevention and patient education are critical in reducing melanoma risk. Patients should be advised to avoid tanning beds and excessive sun exposure. Use broad-spectrum sunscreen and wear protective clothing. Regular self-skin examination and prompt evaluation of any suspicious or changing lesions should be encouraged, and patients should be taught to recognize the ABCDE signs of melanoma.